Good morning, everybody. This is Vice Chair Senator Martine LaRocque here. Chair Lyons is at a conference committee this morning. She'll be joining us shortly. While she is away, we're going to go ahead and get started. And this morning we are going to start with H91. And we have Jean Montrose, or Jeanne, as we would say in French, Jeanne Montrose, the Executive Director of Helping Overcome Poverty's Effects, or HOPE. And she is going to speak to us a little bit about H91. She is up on the screen. Thank you for being with us, Jean.
Thank you so much for the opportunity to speak with you. For those of you who don't know me, I've got 40 years of experience in human services. Prior to my current position, I was executive director of the local court diversion program. Also, for a number of years, I was the state administrator for Vermont court diversion programs. And at that time, I spent a lot of time in Montpelier. Right now, I am at an organization where I've been for 25 years this fall. It's a privately funded organization that morphed out of the local CAP agency in 1965. We run one of the largest food shelves in the area. We have a large resale store. We provide financial assistance with heat, housing, medical, and job-related needs, and just about anything else that somebody comes to us needing, as long as we are not able to have them get it elsewhere, and that we have the funding for. So that is what keeps us at this organization. We started the John Grimm Shelter in the 1980s. We were in affordable housing for about a decade. We created close to 400 units of affordable housing, and we were the impetus for starting a low barrier shelter a number of years ago, which has now become the Charterhouse Coalition. We currently are the county PATH provider. That is a grant program out of the Department of Mental Health. And with that, we do street outreach and intensive work with people who have severe mental illness and substance use disorders. I have seen this grant, the HOP grant, grow out of what began, I think, in 2009, 2008, when we had the huge financial crisis. And it has morphed over the years. In early years, it was administered by the Department for Children and Families. And I have to say that was not a good process at that time. Since it has been moved under the administration of the Office of Economic Opportunity, it has become a very effective, very successful program. And so I do have concerns about at least moving quickly to decouple that. We've got a significant financial crisis going on in our country. We have issues with state finances regarding property tax. We have a medical care crisis looming, and our homeless program has grown to be very, very large. We've wasted a lot of money, in my opinion, by putting people in hotel rooms without having sufficient funding to provide the services that they need to move on from that, and that's what we're dealing with now. And I think any of the organizations around the state who are dealing with the people coming out of motel rooms can say that it is a real challenge. We need to build more housing. We all know that. We know that we need the services that go with that, and we need the subsidies. Right now, we're looking at looming significant cuts in federal funding. And we just saw last week they're planning to cut housing subsidies. I'm certain that they're also going to be cutting funding for people with mental illness, people with substance use disorders. And I think that right now there is so much uncertainty, and we're going to be faced with so many more challenges, that moving a very successful program out of the Office of Economic Opportunity in a quick manner it's going to be really ineffective. I think it's going to cause more problems than it will solve. I think that there are a lot of good pieces to this bill. I think moving the GA program to the local agencies will be an improvement. But I would encourage you, rather than just saying, this is what we're going to do, we're going to move the HOP program out to the CAP agencies, I would encourage you to have a study committee on that. Perhaps that could be done in conjunction with Act 119.
Thank you, Jean. Was that your testimony for today?
Yes, it was. Thank you.
Okay, wonderful. So I think I heard you saying that in lieu of doing a transition over the next few years, you would recommend a study committee. Do you have a sense of what a timeline might look like for you if we were to move forward with this plan?
I would say maybe 3 to 4 years at the shortest. I do think that it needs to be studied. And I think that we need to take some time to see what's going to be happening in regard to the federal administration. There are a lot of unknowns. I think that we really need to evaluate the CAP agencies. I don't think moving it is going to save us a lot of money in administration. I think that it's going to take some real effort and some real funding to ramp up the CAP agency's ability to administer this to the level needed. And I also think, quite frankly, that funding for the HOP may be going away. I don't know how the state is going to be able to backfill that on a continuing basis while trying to make up for all of the other cuts that are coming down the road. So I think the leadership of OEO is what we need to do to hold steady for the next few years while we work to say, is there a better way? Is there a way of saving more money? But I think just moving it now is not a wise thing to do.
Thank you, Jean. We appreciate your testimony and thank you for highlighting the instability that's coming from the federal government. We're certainly feeling it here. So I appreciate you bringing that to the fore. Would anyone else in the committee like to ask any questions at this time? Okay.
Can I ask where Hope is located?
We are in Middlebury. We serve the entire Addison County area, and we actually move across county borders at times, especially with food.
Thank you.
Thank you very much for your testimony. Much appreciated. We've taken down the notes and we'll share them with our chair.
Thank you.
You. Does anyone want to respond to anything that was just said or?
I think she's fine.
Yeah, it's scary times for sure.
Now, I have doubts about the CAP's continuing funding. They just haven't gotten that far down.
Okay, well, I think the idea of a study is interesting. It's intriguing.
Or a demonstration project.
Right.
To try to see if try 1 or 2 CAPs and see if they can in fact do everything we hope, and if we fund them adequately, I think they can do. But if their base funding goes away, we're right another whole.
Yeah. Yeah, no, good point. Katie, would you like to do a walkthrough with us on that deck? It was scheduled for markup, so that is what we can do. Thank you.
I've brought my list of things, so.
Oh, yeah, oh, great, okay, well, now's your chance, Senator Douglas.
Good morning.
Good morning.
With the House Elected Council. Here, draft we're working on. So this is 2.1. This is what we walked through last time. I think, you know, it says you spoke, but I know you have a lot more marketing. So where would you like to start?
I don't think you need to do the findings again unless anyone feels strongly that we need to do that. I'm not sure we need to go through the intent either. So we could start on page 4.
Okay. This is where we create the new chapter. If you remember, this chapter is being amended several times because there are several effective dates. So what would initially take effect is language that establishes the program, gives it the title of VHARD, the purpose section that is not specific to HOP because that is added at a later date, the definition section, and the advisory councils. And you wanted the regional advisory councils to take effect sooner rather than later, so they have a chance to be fulfilling their advisory capacity and developing the program. So that would take effect earlier than the implementation of the program.
I think Senator Douglas might.
Oh my gosh, John, to answer. So
Oh.
I just didn't know if we wanted to lay out a little bit more clearly the process of shall convene a regional advisory council. Or is it kind of just carte blanche and we just kind of, I'm thinking that,
This language is pretty flexible.
Yeah.
That they could convene the group. It's not limited in number. They could select who they would like. So the members are organizations providing services in the region. So that's the limiting factor. But it could collaborate with any number of other entities. But by design, it is fairly broad.
maybe we should put a minimum number of members on it because they could just do themselves and one other organization that provides services, and that's just a regional advisory council with 2 people.
I will mark that down as something that you can, mention to the chair. What would you be, what are you thinking about as a minimum?
I don't know, maybe 5, that seems pretty reasonable.
I think that down to the members of the council shall include organizations providing services in the region. If we don't trust them, then we shouldn't do it. I think no,
They'll figure it out.
I think, yeah. And if they don't, I think whoever gets left out will.
Or else,
Yeah, typically people will want to have a say, so they might advocate for getting, being part of it, but, I made note of it, so.
you know, and what Senator Cummings said is fair. I also agree with you about the may language on municipalities.
Mhm.
And honestly, I think that they should probably include all these different words.
Right,
Or we send them a letter and invite them.
right, that's, I'll make note of that too. I know, in my region, the municipalities definitely want to be part of this. So it may be, maybe if you could do a shall for that part.
Or they could be moved up to the show.
Okay. Right. Does that make sense?
I said I am not,
You don't want to dictate.
no, I am not comfortable working on the assumption that this is just going to happen. I am concerned about having 5 different sets of administrative, expenses, which is going to be money that's been, because we haven't added anything to the pot, that's going to be money that comes out. I would like initially with the caps to give us, before we pull the trigger, I would like to get proposed budget from the caps. What's it going to cost them to do everything here? Or because we've got transition money, but the people they have to hire to do this and to ramp up to provide the services. And I think if our local mental health agency had the ability to provide the services, they would be doing it now. Why aren't they? Is it because I know they all have huge vacancy rates? I know we have consistently underfunded them. So to just say, well, we're going to do this, and we haven't really assessed what's wrong now. And I'm afraid once we are getting the emails and we've just kind of slumped this off to somebody else, we will as we have with our other community-based agencies, lose the incentive to fund it. So I want to make sure we're gonna help the people we're trying to help.
Well, I mean, so we could add budget piece to the bill. We could require that each CAP present a budget ahead of time. I don't know, it's something to think about.
I'm still trying to figure out what this timeline is. It might be helpful, I guess, in the send down. Oh,
Maybe someone would do a visual.
I'm a visual.
I know, it's
Yeah.
always helpful to have a visual, I agree. Senator Jones, did you want?
Yeah, so, mental health is a big I think it's not really in their wheelhouse. They focus more on the mental health side, and here, yeah, there are some cases. On the budget piece, I think somebody brought this up last week. I'm worried that if we ask them to make a budget, it'll be very, very large rather than us prescribing how much money that we have and then building a budget based off of what they have.
Yeah,
I don't remember.
I
brought that up last week.
trust them more than that, but I also know. Man, they have a citizen board. And so, and that board is gonna have to approve this. But I just can't see how we've got 3 people in OEO running the program. And suddenly and I'd like to hear the numbers from the state as to how much we're spending on the call center that we're told we're going to close. And that's what's going to go to help run this thing. I'm just the numbers.
I know you are.
No, I'm not really. I never did well at that.
I do agree with you that I would be very helpful, to have all the caps or cause or whatever they're involved in now. Just to send us caps, to send us like, an inventory of what they already provide, what they already have, what infrastructure is available, what positions they could
Right.
reallocate and shift around. What can they do?
Yeah.
What can they do right now without any money?
Yes.
What can they do?
Let's hear from Frank, his hands up, he might have something to add to the conversation.
Yeah, definitely appreciate it. So Frank Connect with the Housing and Homelessness Alliance of Vermont. I just want to flag in terms of existing infrastructure for regional, we already have the 2 COCs that are HUD mandated and funded. And so we have the Chittenden County Homeless Alliance and also within the balance of state continuum of
You're
care.
talking even faster than I can.
So we have the 2 COCs that
What
are
are TOC?
COCs, continuum of care, which are the HUD funded and mandated homelessness prevention response infrastructure units in Vermont. And so
Where are
within,
they?
so within Chittenden County, they have their own that oversees all of Chittenden County. And then there's what's called the balanced state continuum of care, which is the continuum of care for the remainder of Vermont. Within that, there are 11 local housing coalitions that already
Yeah.
exist, that already have infrastructure, that already have governance policies, that already have trust. And so I just wanted to lift that up in terms of like what this regional regime might look like. We already have a strong regional infrastructure. I think to your point, Senator, the issue really is we don't have the capacity at that level, the funding to be able to deal with the crisis. So we have each of those local housing coalitions has a coordinated entry lead agency, and the coordinated entry system works well. But it's only a process, and it only works if you have housing and people into and you have supports to connect people to. And those are where the gaps exist right now, is we don't have the housing to move people into, we don't have the services at the level we need to connect people to. But in terms of the infrastructure, we already have that infrastructure. It's just the funding of what we need to move people out of homelessness and to prevent homelessness that we
Thank
need.
you, Frank. Can you explain to us how the caps work with the 2 COCs? How does all that live together in the
They
ecosystem?
aren't building housing. I mean, I just know locally, Downstreet builds housing. CAPS have food shelves, they do education, they do job training. It's been a number of years, but they're an anti-poverty agency. Why we've chosen them and not Good Samaritan Haven, who runs our homeless program, or not. You know,
And I think
yeah, I mean, we're moving responsibility. We're moving some funding. But the more of the funding we use to administer a program, the less funding there is to provide substance abuse, mental health. Never mind trying to build additional housing, which is extremely expensive. I'm having trouble understanding how this is going to improve the situation. And my goal is to do better coordinated, entry, to do more old-fashioned social work where somebody first get the low-hanging fruit, the folks that have been priced out of the market and became homeless without other issues. Because if you remain homeless, you'll develop other issues. And then build up, from there. But there's no way we're going to do this on the cheap.
Right.
And I'm afraid we're kind of sloughing it off so that we aren't faced with the rallies out front every spring and fall. Right. And that's I want to make sure if we're going to do this, we take the time to make sure that we are going to deliver a better product to the people that need it.
Agreed. All right, so,
if I can just answer.
yeah, Frank, and then I think Ms. Sojourner would like to speak, and Brent, I think you might want to say something.
And to answer your question, Senator, about the role of the CAPS right now within the COCs and the local housing coalitions, I think it very much varies depending on the jurisdiction. The CAPS are involved, but at various levels. So like the Northeast Kingdom, the CAP up there is leading the effort. And if you're looking at Bennington with Brock, in Bennington County, they're the lead agency, coordinated entry agency, but in Rockland they are not. That's HBC. And so it really depends. And we already have all this infrastructure in place.
Okay, great.
So some do it, some don't. Yes, here I would assume Good Samaritan would have the infrastructure.
Yeah. Did you want to say?
Thank you. For the record, Lily Sojourner, the Director of the Office of Economic Opportunity. I was going to add on what was just shared, that the 5 community action agencies are all recipients of Housing Opportunity Grant Program, or HOP funding. They, in many communities, do serve the role as coordinated entry lead agency. So in Bennington, Burlington, St. Albans, the Northeast Kingdom, Morrisville, and in Central Vermont, they do as well. A number of them also provide emergency shelter services, Capstone, Northeast Kingdom Community Action, CVOO, GROG. So they definitely are involved in that system, as well as doing all the anti-poverty work that you mentioned too, Senator. So they are one of those 5, are very much a part of the 30, 40 agencies that we serve through HOP. And again, to Frank's point, they just play slightly different roles in each community.
Have you heard anything about their federal funding?
So I think, like many programs that we, rely on in Vermont and nationally, like LIHEAP, for instance, like Head Start, like others, that is in question. I think we're a long way from here to September. So I think it's something we're all going to monitor closely. I will say, just so you can have some numbers associated with it, Vermont receives just over $4 million in community service block grant funds. Approximately 3.6 million is passed on directly to the community action agencies. So it is very important core funding for them. The nature of community service block grant funding too is flexible to the local needs of each community. it is not necessarily the majority of each agency's funding. That also varies agency by agency. So for instance, Head Start in Vermont is, I think, nearly $30 million. So that for some agencies would be more of a financial risk in terms of percentage of their budget.
And that has been,
Talked about as well.
Yes.
Yeah.
But
And
finish up, Lily, and then we'll go to Brenda, then back to Katie.
sure.
and so then just so that's approximately 4 million, just so you have that awareness. And then in the Housing Opportunity Grant program, we leverage about $1.7 million from the Housing and Urban Development federal funding. That right now looks like it's proposed to be consolidated across a couple funding streams. And slightly reduced, so it's unclear how that would play out. Right now, the majority of the Housing Opportunity Grant Program budget, along with general assistance, is general fund. But again, I think just the whole picture and whether or not there are other pressures. Happy to answer any other questions.
That was,
Yeah, yes.
that was closely tied to the community action program.
Yes.
Brenda Siegel, Executive Director of End Homelessness Vermont. I first of all just wanted to respond to what people can do with what they have now. I think people are doing what they can with what they have now. I don't know if you meant that.
I meant just like an inventory, just send.
Yeah.
That's a list.
Okay, and I think that that's easily available for any organization, probably what we already do, but also in the middle of currently right now in this moment, handling a pretty chaotic transition. And so I know that the caps are as well. Just want to say that defense of them for the moment. It is pretty overwhelmingly chaotic right now. And so that is the first thing. I in this section or in the other in another section, if we could just include, I feel like a broken record, but if we could just include statewide organizations that serve homelessness in these groups, the overall challenge that I think where we would have to be, where us or other organizations would have to be engaging in 5 different districts is something that I'll send language for another suggestion, but if this is here, then I think I would just like to make sure that that's there as well. And then the other piece is that I think funding is definitely on everyone's mind. I keep joking that we fortunately don't get any federal funding, so we don't have to worry about that. But I do think that this is a big enough part of the project that would become part of the project. And my experience with working with the CAFs, as someone who's working statewide and has had to engage with every one of them, it has been largely positive. And where there have been challenges, they don't disagree, and there are things that they're open and I can come to them without like great defensiveness or anything. So I just wanted to put that into I don't think that I have no fear that they can't handle this.
Yeah.
And in the beginning, I was not largely convinced. So this has been a transition for me in many conversations.
That's good to hear. And I think I hear Senator Cummings that it doesn't feel right to rely on anecdotal evidence, but to have like some numbers and would be really, really helpful to us in the legislature.
I have no doubt the CAPS can do it.
Yeah.
And they've all said this, if we adequately resource them. And I think before we pull the trigger and just dump it on them, we need them to tell us what adequately resourced is. And then we can look at what we've got and decide, is this the goal for everyone is to get the most level of service to the people that need it. And is this the best way to do it?
Right.
I don't know if you see.
I kind of want to get back to Katie because she's doing this walkthrough with us right now. I don't know if you have a time constraint.
You have me until noon.
Okay, great. Then, would you mind if we heard briefly from the council?
Yeah, I'm sorry, I'm listening to the budget conference committee, Amy Schollenberger, I represent VCAP. I just wanted to say that we have already submitted a document that lists all of the homelessness services that the CAPs do. We were meant to testify on that and got bumped, so we never got to say it on the record. But you have a document on your website that we submitted about a week and a half ago now. So that's I believe that's the story you're looking for. I also wanted to say that the CAPs have heard your request to work on a very specific budget. I believe you'll have that by the end of the week.
Great, okay, that's helpful, thank you. All right, great. So Katie, go ahead. We were at wrapping up, I think, the advisory councils.
Okay. We have the responsibilities of the council, how often it meets, and who provides legal and technical support. And then, on page 7, midway down the page, we're amending in section 4, the chapter that was just established. So what we looked at with the regional council, that takes effect July 1, 26, and then it's being amended July 1, 26. Did I say first 25, then 26? And this is where the program itself really, all of the components are codified. So we're amending the definition of community action agency in this section to be and including, in addition to what we traditionally think of as a community action, or any entity or entities otherwise authorized by the department to fill the duties of a community action agency under this chapter. Because we've already spoke that if a community action agency cannot or will not meet the requirements of the chapter, that there's an opportunity for the department to select another community action agency or another entity to perform those duties. And then we are establishing the program in 2204. And we're this language lists the type of populations being served to the extent funds exist. First, in subdivision 1, the department is to select and contract with a statewide organization that has population-specific experience to specifically provide or cause to be provided supportive services to shelter to those households that are experiencing or have experienced domestic or sexual violence. In subdivision 2, all other participating households are served by or through a community action agency responsible for a geographically distinct region of the state. The community action agencies participating in the program shall provide supportive services, extreme weather event shelter, and emergency shelter. So those are sort of the 3 categories of services that community action agencies would be providing. And then in 2205, we have language authorizing the community action agencies, and there's a process in place for reauthorization review. The department is to authorize a community action agency to serve or cause to be served households that are homeless or at risk of becoming homeless in geographically distinct areas of the state that meets the criteria in this section. And then we go on to list what are the criteria. Much of this list is taken from the bill as passed the House. Existing and planned infrastructure to support households in the region, including a leadership team, human resources staff, and the ability to receive grant funding and issue subgrants. The ability to meet the department's reporting requirements, including having a past history of reporting compliance. The ability to perform the services required pursuant to 2206. Any outcome measures established in the chapter. Again, that was placeholder language because you will be getting a report back on what outcome measures should be used. And then community connections with other providers in the region, including local housing coalitions, housing providers, providers of coordinated entry, continuous care, faith-based organizations, and providers of services to individuals who are older Vermonters, individuals who have disabilities, substance use disorder, or mental health condition, individuals re-entering the community after incarceration, individuals transitioning from care and custody of the Commissioner for Children, Families, and Families with Children. and the ability to provide plain language communications to households receiving services. In subsection C, this is the reauthorization review. Not less than every 3 years, the department shall conduct a reauthorization review of each community action agency, providing or causing to provide services under the chapter. An organization that no longer meets the requirements in subsection B of this section, or that has failed to meet the needs of households in its region that are homeless or at risk of homelessness, may be subject to remedial assistance from the department, or the department may not choose to reauthorize the community action agency.
Quick question for someone, maybe not you, Katie, but maybe someone in the room. This number 6 up on the top of this page, the ability to provide plain language communications to households receiving services. Is that something that the CAPs already do? They translated documents or videos or, okay, thanks.
Thank you. In 2206, this is the section where we pulled all of the services into one section. Like 2204 is specific to households experiencing domestic or sexual violence. And we have a separate organization that's managing the services for those for that population. And then in subsection B, the community that should be community action agency. We already talked about that.
Oh, right.
Shall offer or cause to be offered in collaboration with community partners, each of the following services. I'm gonna make sure I caught that one in my notes. I did.
I'm still confused or unclear of the difference between a CAP and a COP.
So I think what we said last time, I'm also learning along with you, but the agency is the individual agency and CAP is more of the system, but I'm happy to be corrected.
Okay. Lily?
VCAP stands for Vermont Community Action Partnership, so that's their state association.
Right.
I think that, as with many things, there are sometimes multiple names. So you'll see community action agencies, you'll see in some of the federal language eligible entities. I think, again, people might call them CAP agencies. I think to some extent that's okay. And obviously you have to just pick one thing for the purposes of this, but that already is an existing kind of conundrum of having multiple identifiers out there
Okay.
for them.
Yeah.
And I think that's some historical
I feel like
evolution.
the brochure we got said CAP on it, so that's why it's a little confusing, but okay.
That's
thank you.
right.
Yeah, so we need to be CAP, yeah, on community, oh, that's the.
Their partnership,
Yeah.
and then again, they're all 5 as a state association.
Got it, okay, thank you. I think I get it now.
Continue, okay.
That's important.
So in subsection B, we're touching on all the different services. And each services is numerically listed. So 1, supportive services, then we have a list. 2 is the emergency or the extreme weather event shelters, and 3 is the emergency shelters. So 1, there is an illustrative list, much of which is taken from the House language. It was brought to my attention in 12 that they would provide healthcare assistance. That what you probably mean is a referral to healthcare assistance. You don't intend for the CAPs to provide that service.
Yeah.
Are you good, will you change the language?
I will. Mhm. That's We've also added job training and employment services, services related to disability and independent living. In subdivision 2, again, this is operation of extreme weather event shelters, and I tried to bring the House language along here so that this is the operation of extreme weather event shelters, which may include time-limited congregate accommodations and may be provided through agreements with municipalities and other entities, utilizing available data and considering geographic access to prioritize funding for this purpose. And then the operation of emergency shelters, if you remember in the as-passed House version, this is broken into 2 categories, and here this has been collapsed into just emergency shelters instead of, I forget now, temporary and transitional. The the operation of emergency shelters in a manner that builds upon the federally required community planning process and prioritizes households with need of the services of an emergency shelter, which may include community-based shelters, temporary use of hotels or motels, lease agreements for full or partial use of an existing building, need-specific shelter arrangements, master grant leases, the development of shelter capacity or other arrangements, or combinations of arrangements that comply with the intent of the chapter. So,
So I'm coming into the middle of this. Thank you.
You're
Gonna
coming
keep
back.
going. So the later on, this is a question of clarification. Probably not rhetorical because I can't remember. Later on, we have a linkage with our housing goals and with housing folks. So the
meaning-
regional planning commission
Yeah.
housing goals.
there is language about
That's
the
later.
targets, yeah.
Yeah, thank you. And I've done my usual rant about, I don't think we've built an adequate foundation about the affordability. If this is the most efficient, affordable way to deliver services. I think we need to do a year to assess before we pull the curtain. Okay.
Okay. The next section is the use of hotels and motel rooms. This subsection A, first starts with an intent to decrease reliance on hotels and motels. And then it has language that, requires that as shelter capacity in each region increases, that the use of, hotels and motels in that region has a corresponding decrease, and that, data is to be provided to the General Assembly as part of the department's budget presentation each year to provide data on what the decrease or increase in shelter capacity and what has been, and then what the corresponding proposed decrease in use of hotels and motel rooms should be.
Kind of the chicken and egg question is, do we set goals or do we wait to see what happens? I mean, do we have any goals later on? I'm trying to remember that one too, but we'll just hold that thought.
Okay.
Because do we set goals for reduction? So next year we want to see a reduction of X number of, or somehow reducing. It says it, but it doesn't. That's, if we get there, trying to reduce that dependence. It's a huge amount of money. So, and it's probably not the best interest of people to keep going the way we are. Just a comment.
The subsection B, you change it to if hotels and motels are provided, emergency shelter provided under the chapter has to comply with program rules and other existing rules. Subsection C has to do with motel rates being presented as part of the budget presentation for General Assembly approval. D discusses negotiated block rates for motel rooms if they're used. And then in 2208, we have a list of duties of the department. The department with oversight of AHS shall have statewide responsibility for meeting the intent of the chapter, including statewide planning, system development, and the involvement of all the agency departments. And then we have a list that came from the House bill. You'll notice that there is some renumbering because some of the items that were originally on the list were pulled out so that they could be part of earlier reporting instead of embedded in this list. There's also a few places where it says and maintain. I don't think that's the only one. Because this says to develop standards or develop guidance, that those recommendation or requirements are being moved up in the timeline. So this would be ongoing law, hence the maintaining those guidance and standards.
So general question again, what kind of reporting back do we have so that the AHS oversight is looking at outcomes?
So you have two pieces. You have many pieces, actually. So one piece of the puzzle is that by October, you're having performance measures, and you could formally adopt them or not. But that information is coming back to you, and you sort of have a placeholder for where those might go. You also have a new section that we haven't gotten to yet today, that is monthly reporting from the department, and it sort of influenced by existing reporting requirements that you have. 2209 Regional Planning and Needs Assessment. As part of the plan that's required every 3 years under Title III. And the federally required planning and needs assessment for the continuums of care. The community action agencies are to develop a regional needs assessment and planning process in collaboration with community and state partners for use in each community action agency's region to inform future plans addressing housing and homeless needs in each region. I'm just going to pause there and remind you, this is the ongoing language. So this is an ongoing regional needs assessment every 3 years. Also, in this draft of the bill, there is an initial regional needs assessment that's reported back to the General Assembly in two pieces. So you'll get the first piece in January, more of a progress report, and a final version of the regional needs assessment in April. The contents of this assessment and planning process include addressing progress in reducing the number of households experiencing homelessness, assessing the rate of households placed in permanent housing, return to homelessness and underlying reasons for that, identifying resources developed and utilized in the region to address homelessness, and efforts to improve the equitable distribution of these resources in the region, reporting the rate of household participation of coordinated entry processes and case management services, identifying system gaps in the funding needed to address those gaps, including periodic inflationary adjustments, and utilizing data, including Vermont point-in-time count, coordinated entry assessment results, and community conversations. Every 3 years, each community action agency is to submit its plans developed pursuant to the section to the department in a format prescribed by the department. On receipt of those plans, the department is to consolidate them and submit them to the various policy committees. And then this is the reporting requirements that I was just referring to. So this is an ongoing law. This is a monthly report similar to what you've been receiving. And if you remember, this will be bumped out to a quarterly report after a couple of years. So each month the department is to provide various data to the policy committees, including the number of households served through the program by household size, eligibility category if applicable, region, service provider, and the type of service. Oh, then I just had a thought. So the program, as you know, is split into CAPS and the agency providing services to folks with domestic and sexual violence. And we're not clear which population, which data we're collecting. Maybe our intent is to collect both.
Well, the question here, I'm starting to think the same thing. So where are they getting the data from? Who's reporting to the agency on this? So it has to be, it's going to go, the OEO will have some of it through COPS, right? And then we've got the cause.
Okay.
So somehow there has to be data, a data funnel.
Mhm.
Yes. Can get complicated.
So I will, and in the next draft, I will specify that that there is data that is capturing both populations being served. Both folks being served by the CAS and by the network.
And then. Okay. Yeah. Forgot network. Thank you.
So then 2 changes in shelter capacity since the previous reporting period. number of diversions made during the previous reporting period, number of households whose intake assessment indicated a potential need for services from each department within the state, number of beds available for emergency housing in each region of the state, with separate reporting on the number of beds available in nursing homes and residential care homes for individuals whose screening indicates they could meet the clinical criteria for those settings, and the number of emergency beds available for individuals whose screening indicates they do not meet the clinical criteria, including low barrier shelters, beds for youth, and beds for individuals who have experienced domestic violence. Top of page 18, the number of individuals who have been successfully transitioned to permanent housing since the previous reporting period, the types of housing settings to which they've been placed, and the supportive services they are receiving in conjunction with their housing. The outlook for transitioning additional households to permanent housing in the coming months, including an estimate of the number of households likely to be placed per month. Any state rules or local regulations and ordinances that are impeding the timely development of safe, decent, affordable housing in Vermont communities in order to identify areas in which flexibility or discretion are available, and advise whether the temporary suspension of relevant state rules and local regulations and ordinances, or the adoption or amendment of state rules would facilitate faster and less costly revitalization of existing housing and construction of new housing units. An inventory of all subgrants issued by the statewide organization serving households experiencing or who have experienced domestic or sexual violence.
Okay.
And by, oh, I'm sorry.
Yep, so going back then to be, local regulations and ordinances, so this really gets to zoning issues and NIMBYism and all the rest of those issues. And I'm not, it's wonderful that we're identifying barriers, but the concern that I have is that we overcome some of those barriers. And so just throwing that out there, thinking about how we can improve reception of some of the work that's going on. I know in my district, there's at least one municipality that has its feet dug squarely in the ground and refuses to have any affordable housing or shelters in place. So I'm just giving that out to the committee. There will be other towns across the state, whether it's in a rural area or a more compactly developed area, that is resistant to supporting people, which is one of the reasons why we see everyone migrating to Chittenden County. Okay, it's just, we need to all think carefully about how to overcome and to ensure that there's more of a welcoming attitude and culture. I don't know what to put in here to make that happen. I think about it.
Because the frame is state rules and local regulations and ordinances,
Yeah,
it might have to be language, considerations to incentivize.
yeah.
We can't necessarily legislate a change of attitude.
True, and then I've heard recently from municipalities that because they have shelters and because they're accepting affordable housing and low income support services, that they're spending more money on public safety, and it's hard. We need to support the town or the city with more money to support their public safety needs. Unless there's some kind of change. I mean, this bill could affect change in a way that reduces the need for that public safety and reduces the pressure placed on municipalities. But that concern is there. I've just gotten more emails about it. Not happy people in the leadership positions in their municipalities about how much money it's costing them, the town, to provide the services when these facilities are in place. They care for people. It's a resistance as a result to care for people, which is not a good thing.
There were local
concerns for municipalities about the amount of public safety calls and personnel that went to the motels. And
Yes.
that is a reality. Totally. I saw the police cars up there as often as I saw the school bus. And that's the one in my neighborhood, which is quiet.
So it is again, catch 22, chicken and egg, you know, once you get, or start to reduce dependence on the individual motel rooms. And have more, maybe blocks or shelters and affordable housing. Then maybe the public safety issues begin to dissipate. But in the meantime, municipalities are not happy. Just bringing that up as another constituent concern, not necessarily from my part of the state. I'm getting this from other parts of the state. Any help out there would be welcome. Anybody, go ahead.
Okay. And then, as you already know, we're renumbering regional advisory councils. Because they were originally enacted in a chapter that didn't have other sections or very few sections. So that is the change that's happening there. And then we're cross-referencing a new section that's been added. Effective July 1/27 is when HOP funds begin to be used for VHARS. And so the purpose section is amended to reflect that. July 1, 2023, the reporting requirements, as we just discussed, are monthly, and then after 2023, they become quarterly.
Did we change that to 28? Thought we had 28.
No, but
I
I
haven't
can.
done that. Okay. We talked about it. Each one was set kind of a
Okay.
how to do it transition discussion. So 28. Oh,
Okay. And then, are we ready to? Should I keep going?
how are we feeling?
Okay, Sarah, you had a bunch of questions, right? Or
You have questions?
No, not questions. No, I just have a list of ideas, priorities, where we want to go.
And you're bringing them up as we go through the sections of bill to which they relate?
I haven't, some of them are more general,
Okay, all
but
right, well, if they're
I
related,
have been while you were gone.
okay, well, keep doing it. What, would you have something that relates to the sections that we've just been through?
This one? I don't think so.
Okay.
I mean, because instead of, I don't know how you're feeling, but instead of maybe going through the rest of it, we could hear Sam's suggestions.
Sure, let's go back and do that.
Does that make sense?
A lot of it is stuff we've already talked about, like data collection, aggregation, pension.
Okay.
So do you have questions on the first part of the bill that we've gone through?
0 to 20, 1 to 20.
Maybe I don't have one. Okay.
I didn't even put you on the spot, Senator.
No, but this is
No,
important. I mean, it's really important to get everything out on the table. That's why I keep bringing things up. You leave it to the end and you forget where you are.
I think definitely a big thing that we need to be talking about is the cost, because I don't know how much the governors will be willing to let through a bill that costs 10 million on top of the 30 we're already spending.
Oh, I've heard that. I know the governor wants to veto the bill. Got that. So our goal is to look at the budget and see what money we could save. I don't think at this point we can reduce what's in the budget. And we can't reduce what's in, then that includes HOP. So the governor's proposal is what we're going with in the appropriations conference committee on the $30 million. So now it's a matter of how much does it cost to implement this in the first year. And that's what we'll be talking about. We have to do that in here. It's in the budget, but we can. in the bill. Great thing. Good help. Was there anything else? Any questions other and comments that you want to make on the first 20 pages?
I'm not sure if they're specific to the first 20 pages exactly, but intake discharge process. I think it'd be great to have it standardized across the state. Obviously there needs to be regional differences between the counts or cause, but having a standardized process, how to be the same for all of the intakes and discharges.
I think we asked DCF for some recommendations on that. And we're probably going to hear from you on Friday.
Sure, Senator, for the record, Chris Winters, Commissioner of the Department for Children and Families. Yeah, we have a number of, I think, tweaks to the language that we're still working on. We've been discussing a lot of them with the community action agencies to see where we can agree and come with a joint recommendation. Don't have language for you today, but we certainly will. I think the intake and assessment process is a really important piece of this, and that's included in the October 1 reporting. And the question is whether you want to build anything into, I guess, into this bill about having intake shelters. I think there's a may include intake shelters for the community action agencies in the bill now. So that's definitely a piece that we want to be taking.
Yeah, so I mean, it's a good question to have identified intake, points of intake. The recognizable points of intake, so it's not dispersed. So that's something, is that what you were thinking about?
Yeah, it's just the process that the agencies are using to bring in people, just how that process be standardized. That'd be helpful for cohesion between the different tabs.
Yeah, all right. Hold your thought until we have folks from DCF coming in, and then we'll have that broader discussion on Friday. So we're trying to get everything out here. The questions that we have, intake is one. The other one was oversight and how the agency maintains its oversight. And then the other one is how does the continuum of care fit into this? So, what else did you have?
Pertaining to the first 20 pages, I don't know if I have anything, but I can keep reading on the list of the report.
Yeah.
Has anybody else been doing what I'm doing, or am I the only one?
Well, I think some of us are going through and asking questions as we go through the bill, and that's probably a more productive process, but it's good for you to let us know, share right now what you have.
Well, a big one, I think this goes back to cost savings, is income contribution. DCF used to do that.
Eligibility determination and whether or not there's an income piece with that. And I think DCF, will you be bringing us something on that?
Probably not for this bill. I'm trying to keep things straight. I think in FY 26 GA, which is you just came from that committee, so maybe there's no opportunity to change anything there around it.
Yeah.
For clarity, Senator Douglas, do you mean you'd like the person who's unsheltered to pay?
That's, yeah, and that's what DCF used to do. And if they're able to, then yeah, if they're not able to, no, then obviously if they don't have a job, they don't have any other income.
Right. So I think that some of that currently happens in shelters where people have lost their mortgage or been foreclosed on and they or lost a job. And so that's a different kind of a different discussion.
I do think part of that would be in the report and recommendations for October 1st. I think it's potentially one of those things that's named in that list, and shelters do this in a variety of ways. Some don't do it, but some do.
Yeah.
Create a savings account or things like that as part of their services to the people that they're sheltering. So maybe there could be a report back on recommendations for that.
There is in the bill.
Yeah. Okay. And then good. This is good.
I hear what Senator Douglas is saying, and it seems counterintuitive to me that we're trying to, help people get to a place where they might be able to, have a job or have a place to live, and asking them to, some of them have to, or be able to, okay, so maybe they have a job and they obviously can't afford housing
Or they can.
and or food. So it just seems counterintuitive to be asking them for money when we're trying to get them to a stable place.
It's just that they can't afford it, so else can't find it. A lot of them probably could afford it, they just can't find it. So, you know, if they have a job,
Some of
then,
them are paying 30% of their income towards the motel program.
Yeah,
Which is
that's
what
what-
you're supposed to pay for housing.
Right.
And this, people are a mixed bag. Yeah.
Right, yeah, I don't need to lump everything together, but
and that's
the
all.
goal is that when the housing does become available, that they might be able to have enough money saved up so they could, you know, afford rent or, so anyway, just.
Got it. Sounds like an ongoing discussion. And how to separate out those folks, you know. One group here, there, and you know there are multiple types of individuals coming in who need different support services and counseling and financial management issues. It's all over the place. So go ahead. That's a good one. Anything else there?
No, we can keep going, I can bring them up as we go along. It's fine.
Okay, that's good. And then when DCF comes in, and then again, we're gonna get a report back in October. We won't, but we will. And next January, we'll be back looking at this yet again. But trying to move through the transition from 2 or 3 different programs into one consolidated something.
And Senator, just to add on to that, I think I testified to this at one point, but it is important to the administration that we do things a little bit differently with the GA program right now on intake and assessment. And it's hard to keep track of whether that's something that can be in the appropriations bill language or not, but things like verification of residency, verification and intent to stay in Vermont, verification of homelessness, income contribution, those sorts of things. When we have I've said this before, you might be tired of hearing it, but when we have a limited resource, how do we allocate that fairly and to help the people who need it the most? And that's part of that approach to the GA housing.
I know that the administration is interested in putting the governor's executive order in place, but that's not something that the conference committee is looking at all. If there are some things that we have in here that will facilitate the work of the GA program, and maybe that's a conversation we can have with Ledge Council about how that happens or doesn't happen. But our goal here is VHARTH and moving forward, and the transition over the next year and a year and a half or 2 into a single program.
Those will be part of, I think they're allowed
Yes.
for us to take a look at in the October 1 report, and they'll be part of those recommendations.
Is there anything else that, pages 1 through 20 committee, and now what I'll do is, I'm hesitant, but I'll do it. Is there anyone around the room who would like to make a comment at this point? Frank, you did have your hand up earlier.
I was just gonna note in terms of the intake that we already have
Yeah.
a coordinated entry system.
Yes, we do.
And so that's a uniform process that already exists, so it's one.
It's the where it takes place, and I think it's coordinated entry, and then so having it as a designated, how do we do that? Yeah. But
Thank you.
Okay.
Brenda, and
Brenda Siegel, and Homelessness Vermont. I just wanted to say 2 things. One is, in terms of residency, as you're considering it, people living outside can't actually prove that they live in Vermont. It's very challenging. Many of them don't have IDs. It's very hard to get an ID. I think that is something that would create a huge barrier for people to actually get sheltered and get the support they need. And also, we work with asylum seekers who are using the program, and I think that's really important. And then 2 is that on income contribution, we already know this, but I'm just saying it for the record, that it's really important that people are able to maintain their in savings and keep money, not pay it into the shelter, so that they have it when they become housed, because that's a really big challenge once they're housed, is having the resources they need to have everything they need in that housing, so they don't become unsheltered again.
Okay, thank you. All right, Senator Douglas.
I was just about what Frank said about the intake process. Just the reason I brought that up is, in my day job, like we have our own intake process for our facility, but then the other facilities we work with, that kind of have something different, like the paperwork is different, and sometimes like just trying to go through it and compare the different documents is difficult and makes the process of intake or discharge a little bit more
Uniform
time
across the
intensive.
state.
Yeah, uniform across the state.
You got it. We got that. So coordinated is one thing. So everybody's doing it at the same time in this, but not everybody's doing exactly the same. So it's a matter of trying to fix that. We got it. Anything else? Pages 1 through 20. Is that what? Else there?
So like we had a lively discussion before you got here, but I can fill you in later.
That's the great stuff.
Yeah, I'm happy to tell you what I can sign
Okay.
up for you.
All right. So let's take a 5-minute break. And then we will come back and go. This is important to keep going through this because it is complicated. It's new for some folks and Katie is very patient with us.